I challenge every American who's listening to my words tonight, when you go to, and every young person who has a conscience, go to the supermarket and look for some of the people who are staring at the vegetables or raspberries or fish and they can't afford to buy it. Maybe you could slip them a couple bucks in the supermarket. Nobody even know about it. I've done that so many times. And they can buy something they want that they can't afford to buy. So when you're a senior citizen, limited income is a real fact of everyday life. So for all of the millions and millions of Americans, Congressman Tonko, that you talked about, this is being lived life by life, family by family in the state of Ohio. And I'm very pleased to join both of you and to thank the President of the United States for having the guts to stick with his convictions, and our Speaker then, Nancy Pelosi, for fighting so hard for every vote in this House and really helping to lift all of America to a different plane for the future. And the last thing I will say is I come from a small business family, and our father was one of those people that had to sell his business because he got sick and he had to get health insurance for his family, so he went to work for an automotive company. And I remember how ill he became and what a horrible choice that was for him back then. Half the uninsured in this country are small businesses. The law says if you have 50 or under, you don't have to provide insurance, but if you're interested, those exchanges will be there for you, and there will also be plans that your employees can buy into if they want to. Wow. Do I wish that had existed in the 1950s when we were growing up as young children and our dad could have had that plan so he wouldn't have had to sell his business. What a difference that would have made in our family. So I think, and that story is repeated by the tens of millions across this country. Half of those who could potentially benefit are small business owners and their workers. So thank you for doing this special order tonight as we speak on behalf of all of the American people.
Thank you, Representative Kaptur, and please feel free to share more information with us. But, you know, the anecdotal evidence that you provide from your region alone, you know, speaks to the empowerment that is part of this transition, this progressive policy. And to now attempt to repeal, just as you've given people the sense of hope that there will be a doable outcome, that they won't have to cut medication in half so that they could have enough money to do all the other items that are required of them, to pay utility bills or to afford to eat for that given month. The fact that they would cut their medication in half is not a sound thing. They're spending money and it's probably ineffective. And so tethering people to a system that is sound and secure. You know, when people say, well, I don't want to pay for someone's insurance, I don't want to pay for this health care program, you're paying today through premiums and through taxes. You're paying for the worst sort of outcome by putting people into emergency rooms and having them visit with a different doctor each time they visit, and not having the stability and the standardized outcome that is predictable and effective and efficient. These are the dynamics that are driven by the soundness of a policy like this that, yes, will take investment, but will get far greater bang for the buck than what we're getting today with a, you know, haphazard sort of response that does not provide continuity or direction or standardization or predictability and certainty. We will be far better off, and a much more compassionate response is rendered. So from a taxpayer perspective, from a consumer perspective, it's a far greater, stronger, more intelligent outcome. And it speaks to, I think, the core fabric of this wonderful country, that we do truly care. And this is a way to show it and still be economically sounder in our attempts. So thank you for sharing the anecdotal evidence. Representative Garamendi, you and I have done a number of these special orders on this floor, on this House floor, and I find it fascinating to see what the response is out there from the public, who always call to engage and get more information. And so the fact that we can provide more information on what is included in the Affordable Care Act, I think, is a good opportunity here. And I know you always have a lot to say and a lot to share, and your walk in your professional life as insurance commissioner, it was an important bit of strength for all of us in the caucus.
Well, Mr. Tonko and